veterans have this, why would you put them through that disease and not catch it early? It's not right.
Substantiate to put in the payroll?
No, to substantiate giving them the medication that's required. I know it's expensive, but that's not the case. We were promised health care, and we haven't honored that. And that honored that means that you incur certain
So is what you're saying that they will do that for you?
Yeah. I'm saying
that
there were three.
Okay. So I should say females and males.
Yeah. But I know females that have the problem.
Okay.
And I know that there are others out there. If there's three.
I know you.
Okay.
Yeah.
Also, on the side of that, do you have issues with getting injured and things like that? I'm at risk of being homeless.
I'm at risk of being homeless myself.
Yeah.
I'm sitting in a homeless
Saturday. Okay.
Treasurer for the DMV. I'm sitting my hours off and ask for help with my rent because I'm always going to eat. And no matter who I've spoken to, they don't want to give me cash. They don't want to give me any assistance for help.
All right.
I've been crying about this national department.
Yeah. So if I remember right, actually, no, I'm not going to explain for everybody because it's some patient privacy issues, but we'll certainly meet with you tonight. Is that all right? Okay. But, you know, in generic terms, if you come into the emergency room with some condition and we don't yet know what that condition is, okay, but hold on. So I gave you an opportunity, but you got to give me an opportunity to give you the feedback, right? One size does not fit all, right? So if you come and see us today and you come and see us tomorrow, we don't always know that you're coming to see us for the exact same issue. So they're going to do the diagnostics on you and try to find out what's going on with you each and every episode. We can't always count on what we did last week because there may have been changes between then and today. So what worked yesterday, we'll guarantee that same treatment is going to work today. Now, we're going to meet with you separate, but I just want you to understand, you can't just go to the ED and say, hey, this is what they gave me yesterday, give it to me again today. I know, and I understand, I'm not disagreeing with you. But for our clinicians, they have to find out what is going on with you each and every time you come in because they make a mistake. I'm just telling you our side. Okay, so we'll meet with you guys because obviously we need to be able to communicate and what's separate with you tonight because obviously it's a bigger issue, but you gotta work with us, right? We want to understand your position, but you gotta. All right. So we got work to do with you tonight. I promise you, we'll sit down and go over your conversation and go over yours to try to figure out what to do going forward. Okay. So we had Mike. You have one more. Okay.
And I'll make this more of a general question. It's actually specific to a case with diabetic test strips, and this comes from Leopold Mendez. So your question, but I'll broaden it so it's a little bit more applicable to everyone.
If they can't, they can direct you.
The question involves diabetic test strips, and he's wondering why you can only get 50 per month. Now, your case looks, from what you're saying here, that 50 per month would not be adequate. What we do and what we try to do is provide a clinically adequate quantity, an adequate quantity, so that you can control your diabetes each month. That being said, if you're not adjusting your medications, test strips really don't help. So typically, if you're on oral medications, we give 50 test strips for 90 days. So you can check in once in a while, which is important to make sure your control is, your diabetic control is still under control. When you're on insulin, and if you're adjusting your insulin, you need to test yourself much more. In those cases, like you described, typically we'll prescribe 50, 100, even more, as clinically appropriate, depending on how often you're administering insulin or you're adjusting.
So he also has an issue where there's this hospital that has treatment for what he has. He can stand it.
My friend's coming back, sitting here.
But the FDA they want to prove because the FDA approved it, but it will treat. So it won't cover the cost, even if it's 100%.
And then the other thing is that I was trying to say that on the medical marijuana, the VA needs to help the veterans get their license because, again, it's financial constraint. Yeah.
I'll call you in the morning.
Okay.
And then we'll set up an appointment.
Okay. Absolutely.
I look forward to helping you.
And what's your name?
I'm Joel Diller.
Joel.
I'm actually currently in the National Guard.
Okay.
Combat medic. So EMT too.
Oh, you would love the person that does our Wednesday show. She's our chief benefits specialist, but she does nothing but veterans benefits. And
so I agree with you.
Yeah.
And I don't know this is about your case, but I agree with you. From what you say, it sounds like you need, and if you're giving yourself 5 injections a day, and you're not sensitive to low blood sugar, you need to test it more. So we'll get your name, and I have your name.
I want to speak with her.
Yeah.
Put me in touch with her.
Okay. Joel.
Jorge, right?
George with the J, Scottish, Spanish. Last name dictates the first.
Who you with? What office? What office? Guys, you got me when I graduated college. No. I'm going back to school. I'm Chapter 31 program. Yeah, I already got that. I already got my associate of science.
I agree.
And they tried 6 months to find me a job.
So you already have associates.
Yeah. Associate of science.
Again, I just want to thank the director and his staff for this meeting. I think it's very important, and I appreciate everything you can do to help our veterans. I officially want to thank you for the 2 hours that we really do need to have this forum after 9 days, and I thank you for that. And I just have a couple questions for Emmett, which is for widow benefits. I ran into a couple females who lost their loved ones, and they were like almost near homeless, and they're interested in
disability benefits.
These issues
I only
being
get
married to a veteran and trying to have a contact number where we can refer them so that they can get the help that they need besides being bounced around like a phone. That's number one. And then our veterans are running into a lot of issues with claims, which is the back pay. When they finally come to a conclusion, they mail the money to the bank, and they don't tell them the money's being, and a lot of the times they're being kind of cheated out of the back pay that they receive. I don't know who we look into, or is there a number that we contact in reference to that? And again, when our veterans are filing for claims, I just recently ran into a veteran who filed a claim, and he had PTSD, and he had some other issues, and they only filed PTSD, but they didn't file these other elements in his body, which he was in a boat, and it exploded, and they didn't have any medical records on the report, because thank God they didn't die, and there wasn't no blood around, so they just figured, well, it happened, and they now to this day they have elements affecting their body, which are injuries. So I just want to know, how do we go about finding a way to make sure when our veterans get evaluated, they get evaluated correctly, and they don't try to just go home and say, here, you've been affected by PTSD here, and then down the road, elements have come, and there's a lot of proof that they say that it's not in the records, but yet they were there and were in the situation. So you probably run into a lot of veterans like that. And again, one more and I'm done. Basically, we're working with the Greater LA Hospital, Lee Hospital, and VA for better communication. Work together to assist our veterans and issues that are going on to them. Again, thank you for everything, you guys. Veterans, thank you for all coming.
So when you talk,
okay, so we have a couple of questions that I wanted to get to on the HUD side. So, sorry.
About veterans,
Go on. You've got more. All right, I'm going to try to take all those the best I can here. I'm going to start in reverse.
I didn't punch nobody.
What you spoke of, the last point you made, speaks to what Michael alluded to earlier, and that's the Community Veteran Engagement Board. That is also being established at West LA, or through West LA. And these boards are designed to marshal all the resources that are out there advocating for veterans. Two major ones, obviously, are VA and VHA. But we're not the only ones. And that collaboration helps get greater word out. I would venture to say that the folks here tonight learn from each other based on various topics raised. That's the whole purpose of the Community Veteran Engagement Board. The next point, I don't know if this was in order, but in filing a claim, I would second what the gentleman said earlier tonight regarding the use of veteran service organizations. because they can sit with you and take the time to help you see the claim. We can do things at our office, but we are also not necessarily conveniently located for everybody. Everybody knows what the traffic challenge is here, and that can't be underestimated, I guess. In regard to correctly evaluating folks and the effectiveness, we never try to teach anybody out of anything. And this also goes back to an earlier point that was made. We are advocates for veterans. I'm a veteran. Much of our staff, we are advocates. That being said, we work with the laws and the regulations that we must abide by. Because we also have fiduciary responsibility to all taxpayers, which all of us are. But I just want to be very, very clear that we are advocates. We may have to deliver news that you don't always want to hear, but prior to delivering that news, we need to do everything that we can to advocate for it. There's a sign over there that says I care. Integrity, commitment, advocacy, respect, and excellence. The A is advocacy. That is something that all of us are expected to do. You've heard all the resource challenges. It's very difficult to always advocate as loudly or as quickly as we would like. That is something that we all must do. I'm going to just quickly address the cards that I have remaining. Stacy,
I'll need your help when I graduate my BA.
I would ask you to either go back to, if here, go back to one of our folks back there, and Tony Gwynn. It's also regarding a retro pay issue. I would ask you to do the same. And William Gladney.
Pell Grants.
Is that you, sir? You're welcome to do the same, but if not, to follow up with you, or at least one of our folks will follow up with you. And I will say that we received many of these cards over the, I guess, 7 town halls that we've done. I can't remember. And we do follow up on it. So just give us a little bit of time if we don't actually talk to you tonight, but we'll get back to you. And at least one of these, Mike, yours is in San Diego, so either we'll follow up with them or ask them to reach out to you. Okay? At the risk of getting long-winded, I'll turn it over.
Is there anyone else have cards that they haven't answered? Well, there's lots of them. Okay. Can we do it quickly?
And why they haven't sent me a letter?
I can do one of the two, both quickly. Yeah. I'm Mark Levinsky, I'm the Chief of Geriatrics Rehabilitation and Care. And I can see asked a couple of questions. Who handles home care at Long Beach VA? Well, it depends what kind of home care you're talking about. There are 3. One is home-based primary care, where someone who's homebound, where a team will come in, a doctor, nurse practitioner, nurses, take care of you there. One is for skilled care in the home, bringing a visiting nurse in, and other resources available. And the third is a home-based home health aid. Did you hear any of the 3 things? Is this better? So there's a home-based primary care that brings your PAC team to your home in a sense. There is skilled care where a visiting nurse comes in.
Chief Benefits Officer for
a different team with perhaps other therapists and a social worker, and then there is a homemaker home health aid program where an aide comes in a couple of hours, a few times a week to help people who are dependent on daily activities of daily living. All 3 of those will be accessed through your primary care.
Not yet. This is our page.
And then the second one is, do I need a referral or consult for all therapy? The answer is yes.
Okay.
And then there's another question from Linda Krause about going by the nursing home for the community living center and comparing the help on the weekends versus weekdays.
Get all your emails.
I'm working right up.
I just started there, so
Okay.
I went in for a resume. I'm still on the service. I've always been volunteering while the advocacies